This presentation is on a gardening research tool. Dr. Mathews is an associate professor of human nutrition at the University of Florida. She received her doctoral degree in health and physical activity from the University of Pittsburgh in 2008. Dr. Mathews' research goal is to discover and disseminate interventions to promote nutritious eating and prevent chronic disease. Dr. Mathews conducts community and clinical studies to promote positive lifestyle behaviors to address obesity and weight management, food insecurity, and for those at high risk for chronic diseases such as cardiovascular disease, cancer, and diabetes.
It's great to be here, and thank you for so many people joining today. I'm really excited about this presentation. This is an area of research and interest that was a little bit more of a passion that grew into work, which is always the best combination. So throughout this conference, these last few days, we've heard a lot about the Get Fruve study, and the Get Fruve study was really the platform that launched this area of research for my lab and for our multi-state research team. So today, in the little bit of time that we have, we are going to do a very brief review of garden experiences, past and current. I'll talk briefly about the development of the Youth Gardening Survey instrument, and then I will present some results of how we've used that instrument in assessing gardening experiences and how they relate to fruit and vegetable intake among college students, as well as most recently among high school students. So gardening experiences then and now. Gardening is something, obviously, we've been growing food, since mankind were able to do that. But the kind of the rise and fall of gardens in a community setting have arisen from need. So Victory Gardens specifically grew out of need, out of economic crisis during the First World War. Victory Gardens in that term became very prolific then again in World War II, both in the United States as well as Canada, and then across other countries that were impacted dramatically by the Second World War. That term Victory Gardens has recently been reclaimed by many communities and used as a community intervention to grow food for local communities, particularly in communities that are lacking in access to fresh fruits and vegetables, as well as building a sense of community, a sense of pride in community, and other health outcomes from potentially changes in dietary intake to changes in mental health, self-efficacy, and other factors. What you're probably most familiar with are school gardens. So in the 1970s, school gardens really resurfaced yet again. And in school gardens then, the purpose really, the underlying rationale for incorporating gardens into schools was to provide active learning experiences. So opportunities for children and for teachers to learn about the life cycle of a plant, for instance, to conduct small experiments. So they're testing the scientific process, those kinds of things. But over time then, of course, as science evolved, then many healthcare professionals, including dietitians, became very interested in, well, what does this impact? What is participating in a school garden or a home garden or gardening in general? What does that have to do with the likelihood that a child will try a fruit or a vegetable? Does it increase the likelihood that they would? And does it in any way influence their overall dietary pattern? So just a few statistics, more than 25% of US public elementary schools have a garden on campus, and that number continues to grow. And you'll see lots of philanthropies providing grants to start and sustain school gardens. And 35% of US households grow some form of food in their home or in a community garden. Now that statistic might sound a little bit high to many of you. That can be, just tomatoes in a pot in the backyard to a full-grown garden. As a note, you might recognize those vegetable costumes there at the top. Those are a couple of our undergraduates, dietetic students, that were participating in one of our local school garden programs in a fun day around agriculture, food systems, and healthy eating at one of our elementary schools. So gardening and fruit and vegetable intake. The initial research on gardening really was focused again on elementary schools because that's where most school gardens, where the majority of school gardens started and where the majority of school gardens still remain. The initial research on gardening focused on willingness of children to try different fruits and vegetables, and that short-term impact seemed to be pretty darn clear. The next rendition of studies then looked at actual intake. So assessing whether it was the child's reported intake or the parents' reported intake of their fruits and vegetables, and were they eating more, at least in a short term, after participating in some kind of gardening program. Most of that literature is based in a school setting, and oftentimes the gardening experience is coupled with some form of nutrition education included. And what we saw in reading the literature is that the benefits of gardening, particularly in schools, and incorporating a nutrition curriculum go beyond just fruits and vegetables. It spans really to overall diet quality, knowledge, their experience with the scientific process, and a number of different things. Their willingness to work together and to cooperate, for instance. But at the time that the Get Fruit project started, there was really no literature about gardening experiences and fruit and vegetable intake among college students. At the time that we began that project, there were a handful of studies where really gardening was used for promoting mental health among college students on college campuses, and just their general experience with having a plot outside of their residence hall, for instance. We were very interested in Get Fruit project of how does gardening or gardening experiences at any point in your life potentially relate to your overall diet quality. That stemmed from really many of the campuses involved in the project had active school gardens or places where college students could garden on their campus. So we were seeing this trend really growing already within our own campuses, and we're interested in seeing if it was a factor. However, there was no method to assess current gardening activities or previous gardening activities that a college student may have had, for instance, when they were in elementary school or when they were in high school. So that's what we sought to develop, essentially. And through that survey, we had 4 questions that we were most interested in. First, if had the student ever gardened before? And if so, when? Is it currently gardening? Did you garden in high school? Did you garden as a child? So if you gardened, when did you garden? And then why did you garden? Was it because you were forced to as part of a class or as part of your family? Was it a club that you joined, like 4-H, maybe through your church or a community service program? So what was the underlying reason? What was the passion potentially, or was it required? And then where did you garden? So trying to capture whether those gardening experiences occurred in a school setting, at home, in a community garden, at a church, or all of the above potentially. And then lastly, we were interested in knowing if that student remembered if their gardening experiences also included some form of nutrition education or not. So the process that we went through, and we have not gone through a full validation process with this questionnaire yet, but it has been through 2 different renditions. And essentially, we started the process with item generation within our small team. And so within the Get Fruit project, we had sub-projects. And I led the gardening sub-projects, but had multiple collaborators both here at the University of Florida, as well as within the larger team. So we first drafted our items and went through them several times. And then we went beyond our small team to find some experts to review and refine our questions. And then we did the same thing with our target audience, essentially having college students review the content, provide feedback, and hopefully ensuring that the way the questions were written were the way the questions were interpreted by those students. So after 2 different versions of the survey, essentially the final survey in its form now is 14 questions. Using skip logic, if they've never gardened at all, then it's a much shorter survey, as you can imagine. But it captures gardening experiences in the last 12 months, and then retrospectively, any gardening experiences during their elementary school years, their middle school years, or their high school years. So again, this is a youth gardening experience survey meant to be used for older adolescents. You've heard a lot about the Get Fruit project, and because I'm going to present a little bit of data of how these gardening experiences relate to fruit and vegetable intake based on our findings, I just want to review the timeline and the participants with you a little bit. So across our 8 universities, over 5,000 students were screened for eligibility. That eligibility criteria had to be that they consumed no more than 2 servings of fruit and 3 servings of vegetables per day. So if they reported 5 or more, they were not eligible to participate in the study. And then there were some other exclusionary criteria as well. So of those 5,426 students, 2,757 were eligible to participate based on that first screening questionnaire. So we invited those to participate. And then ultimately 858 completed the survey in the spring of 2016. Participants that did not have a complete gardening data set were removed. And so the data that I'll present now is on 837 first-year college students at the end of their first year of college. So for this sub-project, essentially, we incorporated responses to the demographic questionnaires that were used in the larger study, and then our gardening experience survey, which essentially captured their childhood gardening experiences as well as their most recent, so the last 12 months gardening experiences. And they also completed the National Cancer Institute's fruit and vegetable screener, and from that we calculated their mean fruit and vegetable intake. Here's a snapshot of the participants that completed the study. So essentially about 2/3 were female as well as white. And if you look on the left, the pie chart on the left, 44% of students reported that they had never gardened before. So this is, again, college students at the end of their first year. 31%, almost 32% reported gardening in childhood only. About 5% had been gardening in the last 12 months, and 19% reported gardening both in childhood and in the last 12 months. And then using those categories, if you look at the bar graph on the right, then you can see differences in mean fruit and vegetable intake by no gardening experience, childhood gardening experience only, up into both childhood and recent gardening experience. If you look then, as we divided participants into recent gardening experiences, as that seemed to be particularly important, then there was a significant difference in reported fruit and vegetable intake between those that reported recently gardening and those that did not. So active gardening essentially is how you might perceive that response. And then we looked at frequency of gardening. So from never gardening at all to gardening monthly to gardening weekly. And again, you see a significant stepped response that gardening frequency was important. And those that gardened more often reported greater fruit and vegetable intake than those that reported gardening monthly or never gardening at all. So our conclusions essentially from that first project was that nearly half of college freshmen have no gardening experience. So what an opportunity that could be for teaching, learning, and potentially changing perceptions, self-efficacy, and desire to eat more fruits and vegetables. Students with recent gardening experiences have significantly higher fruit and vegetable intake compared to those with no gardening experience. And so gardening programs targeting first-year college students could be an effective strategy for helping students improve their fruit and vegetable intake. Next, we took this same survey, and most recently, Miranda Battalato, a new graduate student here at the University of Florida, used this study in assessing fruit and vegetable intake and gardening experiences among high school students. And so here, this is data from 375 high school students from 4 different high schools in the state of Florida. And as if you recall, the Healthy Campus Research Consortium, all of these audits are pretty much applicable to both a college campus as well as a K-12 campus. So again, if you look at the number of periods of life with gardening experiences, Miranda analyzed the data in a similar fashion. So students that reported never gardening at all, if we look at the last 12 months, elementary, middle, and high school together, then essentially she then categorized students as reporting 1 period of gardening, 2 periods of gardening, 3 periods of gardening, or gardening throughout all of those time points. So essentially, elementary, middle, high school, and including the last 12 months. There are really no differences between fruit and vegetable intake between those that said never gardened, even up to 3 periods of gardening. But when you look at that 4th period, students that gardened continuously, an entire, 1 more serving of fruits and vegetables per day compared to the other groups. When you look at fruit and vegetable intake in any nutrition study, that is significantly different and a much greater increase. Often it's a 1/4 of a cup or a 1/2 a cup or serving difference. Now to note, these are all, again, self-reported intakes of fruits and vegetables. Also, if you recall, the gardening survey asks about location. So where did you garden? If you look across the highlighted box there, so elementary, middle, high school, and the last 12 months, if you look at the percents column, where are most students gardening if they have gardened in a school setting? So there you see of those that gardened, 64% in elementary school had an experience at school. 57% at middle school had an experience at school, and high school almost 60%. Followed right after by home gardening experiences after that. You can see some other places that students reported gardening at a relative's home, a friend's home, or somewhere else in the community. So how could you get started? Maybe you'd like to use this survey on your own college campus, promote gardening as an intervention for both, improving fruit and vegetable intake, as well as potentially helping manage stress and build community on your own college campus. Then there's usually many ways to get involved. In your own community, local farms often have volunteer days where you can come out and help. You can tour the garden. If your own campus has a garden or a farm, then again, often they may have work days where they're looking for an organization, a club, or a department to come out and help, a cleanup day, a planting day, whatever it might be. Taking your organization, your club, your class to tour a farmer's market and learn about where the produce came from at that farmer's market. Another great place to start is really contacting advisors or faculty in a variety of agricultural science or maybe even nutrition science departments, and finding out what the regulations for planting a garden, or even just having, an above ground, a raised garden, or some pots outside of your residence hall or apartments that are on campus. Those local farms and community gardens and school gardens often even then provide opportunities for team building, for community service hours for individuals as well as for clubs. And another great way to start is by partnering with a gardening club or the master's gardening program, for instance, in your community, to find ways to start building those connections and finding support. Finding that support and those connections are really imperative with starting a garden, because starting a garden is one thing, but maintaining a garden over time it's a labor of love. It takes a lot of work. And you may see, gardens at schools that have started and now they've been left in disrepair. 2 years later, the teacher has moved to another school or moved to a different classroom, and now the garden essentially has been abandoned, and another teacher hasn't taken up that role of the champion in keeping the school garden going. So that's some of the pushback that you might get from your campus or from local school campuses about starting a new garden or an additional garden on your campus. Other resources, the County Cooperative Extension Office. Many college campuses have a 4-H club. They may already have some gardening activities going. There may be a gardening club, potentially partnering your gardening club with Culinary Arts Club for some activities and work together. And I would be happy to take any questions about the survey tool.
Thank you so much, Dr. Mathews. We have a question from the group. Did you distinguish between vegetable and fruit gardening versus flower gardens?
Exactly. We only asked about fruits and vegetables, yes. And the question specifically state that.
Okay. Excellent. And then I have a question. Did you notice a significant difference, or if you didn't, could you hypothesize a significant difference between the size and maybe delivery mode of the program? Those at home growing up on a farm or with a significant garden versus those living in a dorm, perhaps doing some raised beds outside as just a little club project.
Yeah. I would hypothesize that there would be a difference, just as you saw, if I go back, if I'm able to, in the slides, that frequency of gardening being a factor in both, the high school and the college results, seeing that same pattern, that I would think the more intense the program or the involvement, then the stronger the impact. But the survey itself doesn't ask that. Just frequency essentially is the closest we could get to that. And then yes or no, did it include a nutrition education component? But you could certainly, if you use the survey, you could add some opportunities for open-ended responses after that, kind of a please explain, potentially, to collect some more information about that.
Excellent. Thank you.
Welcome.
Are there any other questions from the attendees? I have not necessarily a question, but just an overall maybe observation. I wonder what the overall mental health and well-being of the participants of these programs are versus non-participants.
That's a good, I honestly can't remember. I'm embarrassed to say if we've looked at stress. That's probably within that same data set. Something we should do. We must not have done that, or I would remember. Anecdotally, I see here, at University of Florida, our big medical school and health center is here. And there are now several gardens for patients and caregivers on the campus also. So again, stress, reduction, being outside, building those connections and the positive impact on mental health is clear.
Sure. I had a garden as a child, and I definitely remember just having my hands in the dirt and feeling overall better. But I personally love being outdoors. So
right. Yeah.
That's probably my own bias. Excellent. Well, thank you so much, Dr. Mathews. If there are no further questions, we will conclude this session.